Hello everyone, this is Joanna Odom, and this is going to be my presentation on the respiratory system and asthma for my Anatomy and Physiology 2 course. Okay, let's jump into it. All right, the respiratory system is a network of organs and tissues that are used for gas exchange in the body. It is composed of mostly the nasal cavity, the mouth, the pharynx, the larynx, the trachea, the bronchus, bronchioles, and the alveoli. So our cells need oxygen to perform cellular respiration, and this generates the energy we use. And without oxygen, we really can't produce energy at all, and we really wouldn't be able to function. And the main function of the respiratory system is to supply the body with oxygen and collect CO2 and remove it from the body. Oxygen will bind to hemoglobin and travel through the bloodstream and fuse into the tissues at the capillary beds and go to all the tissues of the body. So here you can see in the alveoli, it is fusing with the capillary for gas exchange. Okay. And then pulmonary ventilation is just another way of saying breathing, and it is how oxygen enters the lungs. And then external respiration is how O2 will get into the blood from the lungs, and then how CO2 leaves the blood and the lungs. All right, so here we have just a little diagram of the alveoli covered with all the capillaries, which are the site of gas exchange. All right, so here we have the trachea, which separates into the right primary and left primary bronchus. And then there would be another side here, but obviously you can't see it. After the primary bronchus, it'll segment off into the lobar bronchus, and then the segmental bronchus, and then the respiratory bronchiole, which have little alveoli sacs on them. And here we have, so as you go down the trachea to the bronchioles, down here, the epithelium will become thinner. The cartilage rings that are on the trachea slowly decrease. And once you get down here, there's almost none left, and it will be just smooth muscle. So there's smooth muscle up here, but not as much. And so you go down, you gain more smooth muscle, and you lose the cartilage. All right, so here is the alveolar sac and the alveoli. And the respiratory bronchioles have alveolar sacs that hold the alveoli, and this is the site of gas exchange. And as you can see, here is the capillary, and it is transferring CO2 and O2 to and from the body. All right, so here there is a thin layer of squamous epithelium on the alveolar sacs. So here is an alveoli, and here you can see the simple squamous. It is just one single layer, so it is very thin, and it makes it easier for the diffusion of gases. And here, the lungs themselves are actually made up of something called stroma, which is elastic connective tissue, and it allows them to stretch when you breathe in and breathe out. All right, so here we have two kinds of pressure in the lungs: the intrapulmonary pressure, or the intraalveolar pressure, which is inside the alveoli, and the intrapleural pressure, which you can see right here. Pleural is for the pleural cavity. It is inside the pleural cavity, and this keeps the lungs open because the pressure is negative. So ventilation is the result of the diaphragm and intercostal muscles contracting. And as you can see, the intercostal muscles contracting, the diaphragm here when you're inspiring, which is breathing in. And then expiration is when those intercostal muscles relax the change in pressure is going to allow for inspiration. All right, let's talk about asthma. So, what are some symptoms of asthma? Just to name a few of them: cough, shortness of breath, difficulty breathing, wheezing, tight chest, and chest pain, dry cough, night cough. And this is also known as bronchial hyperresponsiveness. And just real quick, typically asthma is an episodic. They're typically episodic symptoms, which means they will come and go. So you're not constantly dealing with this every day, hopefully not, but yeah. All right, so here we have an image of the trachea, and as you can see, the cartilage rings on the outside. So this is if it were cut in half and you could see the inside. Here will be the smooth muscle. And so the smooth muscle is the inner lining of the trachea. And with someone with asthma, this will spasm. And this is called bronchospasm. And it will make the person with asthma have difficulty breathing. And let's talk a little bit more about why that happens. So as you move down the trachea, as I said earlier, the cartilage rings sort of disappear and you will just have smooth muscle in the bronchioles. So with asthma, the smooth muscle in the bronchioles can really constrict because there's basically no cartilage to hold it open. And in certain cases, they can constrict so tightly that the bronchioles can completely close off. And that's just the spasm aspect of asthma. But there's, as you can see here, this is someone with asthma. This is them spasming and closing off the bronchioles. This is a normal one, as you can see. Much more way for air, not as much there. But with someone who has asthma, there's also an inflammatory component to it, and this happens in the tunica mucosa. And it is the lining of the mucosa that can become inflamed, and the tissues in the trachea that can become inflamed, and they will puff up and narrow the tube, and they will also produce more mucus, so you can assume that that would make it very difficult to breathe. And then heart rate will typically go up because the heart's overcompensating when a flare-up happens, and then levels of O2 in the blood will decrease during asthmatic flare-ups. All right. Some causes of flare-ups would be any sort of allergies, upper respiratory infections, anxiety, stress, exercise, cold air, common cold, certain medications like beta blockers, and that will be important for later. So how do you diagnose someone with asthma? You will run pulmonary function tests. So the first one is called the spirometry test, and you would have the patient take a deep breath and hold a clip over their nose so that air is not going to go out through their nose, and make them blow into the tube as hard as possible so that they can see your levels of O2 or CO2 and O2. And if the levels are low, they will do a bronchodilator test, and it basically relaxes the smooth muscle, and then they will take another spirometry test to find out if your levels have improved, and that's normally like a good indicator of someone that might have asthma. Then for someone who might have asthmatic symptoms or a history of asthmatic symptoms, but on that particular day at the doctor's office they're fine, you'll probably do a bronchoprovocation test, and this will provoke a bronchospasm, and because the medication is breathed in, someone with asthma will be sensitive to it and it will cause a flare up. All right. Because asthma is episodic, many people really rarely have issues with their asthma, while others may deal with it more frequently and it can be more serious. So it's just dependent on each person, case by case. And what are some treatments for options for people with asthma? So you want to make sure you hold on to an inhaler at all times because you never know when a flare-up could happen. And an inhaler is a bronchodilator, which means it contains albuterol and levobuterol, and these are known as beta agonists. And remember I said earlier how beta blockers will sometimes trigger flare-ups. So this does the exact opposite. It will relax the smooth muscle and get you back to normal. So the inhaler will take care of the spasms, but the inflammatory component, you will typically take something called corticosteroids, and they will reduce the inflammation of the mucosal lining so that they won't be as inflamed. And so basically these will go mainly to the blood because they're not inhaled, but an inhaler will focus on getting the medicine to your lungs without sending it to your blood. So it just depends. And I think that now they have inhalers that have both in them, so you can inhale them both without having to take a pill. All right, so I actually had childhood asthma, and I haven't had to deal with it in a very long time. The last flare-up I had was when I was in 4th grade, and I had to be wheeled out of school, and it was really embarrassing. So that's what I mean when I say it's case by case, because it really does depend. My sister, she is very allergic to a lot of things. She also has asthma, and she has it very, very bad, and she needs to keep her inhaler with her all the time. I haven't had an inhaler in years, and my sister, when she has a flare-up, her face and mouth will sometimes get puffy. She cannot breathe. She needs her inhaler with her at all times, and she's very allergic to a lot of foods, nuts, cat hair. She's allergic to a lot of detergents. Stress easily triggers hers. So, and then my younger brother also has it, but I don't think that his is as bad. He does keep an inhaler on him, but he is definitely not as allergic to things as my sister is. All right, well, thank you for your time, and that was my presentation on the respiratory system and asthma.